Welcome to Health Stealth Radio, where we move away from the mundane to gather insights from the shadows of enterprise and patient cybersecurity. Yes, we surely believe that traditional themes like endpoint software and zero trust are critical, but given massive advances in AI, remote and wearable device hacking, and data hostage negotiators, there's a much darker side to cybersecurity, and not everyone is quite willing to talk about it in public. Health Stealth Radio will thrive on these topics and encourage fireside spats to debate them. Here's your host, Frank Katita.
Welcome, everyone. This is Lisa Gallagher, National Cyber Advisor for CHIME. Today, I'm guest hosting. We'll be talking about the topic of cyber insurance as it pertains to healthcare organizations. I have a fantastic guest today, whom I've known for a number of years. He has a unique perspective on the topic, having served both in the past as both a CISO in a healthcare organization and in his current role as Global CISO for Marsh McLennan. My friend, Dan Bowden, could you please join in and introduce yourself?
Thanks a lot, Lisa. Happy to be here. Dan Bowden, I'm the Global Business CISO at Marsh McLennan. I've been the CISO at Marsh for about 3 years prior, just recently changed roles. And as Lisa mentioned, really enjoyed my time working in healthcare and very happy to have a chance to do some catch-up discussion on it today.
So can you tell us a little bit about Marsh McLennan and how it's organized and sort of where the
Sure.
focus is on healthcare, on risk, and actually on insurance?
Absolutely. Marsh McLennan is a global risk advisory company, and all in, it's about a $24 billion a year organization. And there are four main business units associated with it. Marsh, Mercer, Oliver Wyman, and Guy Carpenter. And Marsh is primarily the insurance brokerage, risk advisor company, and is probably about 60%-ish of the overall revenue. And that's where they're also, along with being the world's largest insurance broker, are the world's largest cyber insurance broker. And for both Marsh, Mercer, Oliver Wyman, they all do business with healthcare organizations in different respects, and have practices that focus on all aspects of managing risk around healthcare. And so it was a lot of fun to come on board to Marsh a little over 3 years ago, as I was previously a Marsh client in my CISO role in healthcare. And so it was great to come in kind of inside, having been a consumer of cyber insurance services, and now opportunity to work on the inside and see how it works, and also still work with healthcare clients.
So I'd like to start off by talking about the threat environment for healthcare provider organizations. So do you think in healthcare organizations are more of a target for ransomware than other types of organizations? And why is that? What kind of information are they looking for? Why is it so attractive? Or is it just that there's a lot of tools to commit cybercrime and they just happen to be one of the targets? And
just from my experience, I think that my time working in healthcare, what I learned about the leaders in healthcare is the availability of services to serve patients is so important to them that kind of contrast that there are some sectors or organizations that they can kind of set their what they may call their principles, that they'll never pay a ransom. On the healthcare side, they don't want to pay a ransom. However, if it comes down to availability or possibly buying your way out of a mess, there are a lot of healthcare CEOs who will probably run down both two paths. They'll tell the CTO, hey, can you recover our systems on our own? Start doing that. And then they're turning to the security and chief counsel leaders. Well, what does paying the ransom look like? Do you need to talk to law enforcement? How does it work? What do we need to do? But I think that's why they're such a target, and it happens so often, is the bad actors, the threat actors know that. They know that if they get somewhere, a healthcare organization, just for the sake of restoring service to their patients, which through my time in healthcare, I respected. But I think that the threat actors know that, and they know, hey, they're likely, if they can't recover quickly, they're likely to just pay and move on and try to restore service.
So you look at the companies you work with, you look at the protections they have in place. Do you think the sector has weaker protections in place? Is that also part of it?
It's interesting. I think that there's still the maturity curve of buying in and adopting good cybersecurity tools, and there are even recently a couple of notable healthcare breaches, and I observed a fair amount of commentary among colleagues and in healthcare about that, and are the leadership and organizations taking it seriously? I do think there's still the haves and the have-nots, and the haves are those organizations that look at it like a financial institution would, where they just don't want to have a breach. We don't want to have an incident. If we don't have an incident, then that solves a lot of other problems. I think that the way the finances are working out, there's still a significant number of have-nots in healthcare. And if they're kind of in a not-for-profit, even though there's the regulation of HIPAA's a one-size-fits-all, self-managed, self-reported framework, and I think unfortunately there's still a significant number of healthcare organizations that haven't made the commitment to get things as secure as they could.
So, in terms of a healthcare provider procuring health insurance, cyber insurance, what kinds of coverage do they need? I mean, we do know that there's downtime or business interruption, but what other things do they need to cover generally?
It's interesting. There's a lot of, whether I'm with Marsh, so I'll mention Marsh. There are other brokers out there as well that the healthcare organizations can engage with. But what they'll do is they'll find out what's your footprint of services. Are you more of a provider? Are you more of a payer? Are you a health tech company? What could go wrong? What are the perils that you're exposed to? And then they'll size that up for you. But I would say a typical healthcare provider organization, incident response is a big one. The forensics behind and supporting that, the external legal counsel about HIPAA is crucial for that. And then, just references about what's next in the event that we're hit. Maybe some resources that can help with recovery, and so I think those are those really important retainers that a healthcare provider organization should look at and be willing to use. And then the cool things they get that they, for some reason, a lot don't use is usually, I would say maybe always, there's a tabletop exercise included. So they could bring in their broker, bring in Marsh, bring in some smart counsel, and sit down with their CEO and executive leaders and walk through a tabletop exercise. That's always been my favorite meeting, because you learn what the CEO's risk tolerance really is in that scenario.
And you help, as an insurance company, you help by providing all of those optional services that come with a policy. Is that right?
That's true.
Okay. Because I think a lot of healthcare providers don't know that they can leverage those services when they're in a situation and work together with their insurer, right?
Yeah. So, and that's the thing, Marsh will work with, like, your broker will figure out and recommend those things. And then when they go to the market of carriers, they'll tell those carriers, this is what we recommend for this client. And those carriers will, basically look at the policy and make sure that you're given pricing that includes that. But Marsh's whole role is to look out for you and say, well, what if? What if this goes wrong? What's the expected kind of blast radius in terms of cost, in terms of business impact, things like that.
So that the goal is to mutually work together to reduce the losses, right?
Absolutely.
Okay, so let me talk a little bit about coverage, right? There's different things that you can cover with a cyber policy. So your own downtime, right? And the losses related to business interruption. But what other things? And in particular, I'm interested in, a newer threat or a newer recognized threat of third parties who have a breach. And how does, what pieces do they need to look for in terms of cyber insurance that would cover them more comprehensively based on all of the threats and risks?
Well, this is such an interesting topic, and I'll check the clock because I'm very passionate about it.
Okay.
The right now with your third parties, you're unfortunately just got contractual language you throw at them, and there's the challenge is there's increasing regulation, and that maybe hits me, and sometimes the regulation says, well, Dan, you have to inflict this on your downstream suppliers, so I'm going to inflict that language on Lisa. Lisa provides an important service to me, and so you're kind of getting caught up in this game of meeting these escalating regulations, and it's being done through contract, right? And we know the ups and downs of contracts. What I'm hopeful, or what I would like to see, I don't know if you're familiar with the DORA regulation in the EU. Rather than just sizing up where you're doing making an inventory of controls against your third party, they actually ask you as the organization, what if that third party goes down? What if they go away? And then do a business impact analysis and rank them. And then what's the cost of the downtime? How do you measure all of that? And I think that's where the insurability, then you ask your broker, okay, let's say I have a revenue generating service. So and I don't know, how Cerner, Epic are configured, admissions and everything is all part of the package. And it's probably unlikely that you just have admissions go down. But in the circumstance where you can divide out a particular service and tie a loss to it, you can talk to your broker about that and say, how do I either insure against it or hold my supplier more accountable? And hopefully the broker can give you some leads on how to do that, but it's still very sticky.
So you could potentially cover your losses from a downstream breach using at least partially, your insurance policy.
It depends. I think it's going to be circumstantial, and
Okay.
it's not easy, and there's a lot of contractual instruments that would need to be inflicted on the downstream supplier, I think, as well.
So talk to your broker.
Yes, and you got to know how good are they, right? If you're using a really bad supplier, it's going to be harder to get some kind of coverage in the event that they have a problem.
This is Health Stealth Radio. I am Lisa Gallagher, your host, cybersecurity advisor for CHIME, and my guest today is Dan Bowden, Global CISO for Marsh McLennan. So Dan, I'd like to move into the area of technology. What might be technology requirements for companies that you will insure? For example, we know that we're urging all of our provider organizations to implement multi-factor authentication. That's just an example. Do you require that? Do you have any other technology mandates that would be something that they need to implement in order to prove to you that they have enough protections in place? Are there any mandates in that area?
Absolutely. And really, if you can actually go on Google and just Google the Marsh 12 key controls, and it'll send you to our website, and you can download basically a PDF describing that, and then you can contact Marsh and do kind of an assessment on it. But Marsh has an assessment that covers basically all of the controls you can dream up. but there are 12 key controls that have been identified that not being strong in these areas does impact your level of insurability. And Marsh will help you assess that. They'll help you balance if you only have a certain amount of money to spend, maybe which one should I strengthen up next? And so there absolutely is a weighting, and MFA is in that 12.
Okay.
It's one of those 12, and so but definitely Marsh does, and probably the other brokers out there as well will provide that information and what kind of technology control should be in place.
Well, I think that's interesting to know, though, that you help an organization along the process. So you don't just say, this is mandated, give us this information, this is how much it's going to cost you. There's a process by which the organization gets to know Marsh and Marsh the organization, and you talk about what is feasible and what is best based on their business model and what they're trying to achieve. I think a lot of people don't realize that, Dan. They learn that along the way, maybe, that you are there to help.
Exactly. And I would even recommend, if they're worried that they're not insurable, make the call anyway,
Okay.
because they have, I guess, what we kind of call a pathway. Well, what are those things you should work on next? And there's a portal that is left up all the time for you to, as a CISO, and maybe even the other risk management type people in your organization, can go in there and update information about your current posture, which things are improving. But I would tell anyone, even if you're worried about where you are today, I would still make the call. And we have the capability to help you understand what's the gap and how to address it.
Well, since you brought up the CISO, I wanted to ask you, when you're working with a healthcare provider, who do you normally work with? Is it someone in the finance group or the IT group? And what's the role of the CISO? So how much do you interact with them? How much, value do they provide to the process? How are they typically involved?
That's a great point, and we actually talk about this amongst ourselves within Marsh. Generally, it's the risk manager, risk officer. So most
Okay.
organizations have a risk officer, or it's someone in the CFO's department. And we unfortunately maybe only see the CISO at the time of filling out the cyber assessment. And we actually are working on how to more directly get in front of CISOs and invite them into the process, rather than having it be a kind of a secondhand introduction from the risk officer. And but the CISO ultimately does get access to that portal to help annotate what the posture is of those controls. And so I would say, yes, we absolutely would love to speak directly with the CISO, would love to hear from CISOs, and are actively working on measures to meet them more directly.
So what would you advise a CISO to do? To be proactive and say, hey, I'd like to help with this process? I mean, I
I think
assume it
so.
add value to you at Marsh, right?
Yeah, it's a great point, because I think, and in healthcare, you've got this really broad range of CISOs. Some have been doing it a long time. You and I are friends with a couple who are maybe some of the best CISOs on the planet,
Right.
regardless of sector. And then there are some who just they kind of, maybe, I don't want to say get stuck with the job, right? They ended up being anointed because out of necessity. But what I would say is, get involved with the CFO, get involved with the risk manager, and then don't be afraid to go out and do your own homework. Look up cyber insurance brokers and go
Oh,
find out what they have. And there are now often, podcasts, webinars, etc., where people are talking about cyber insurance. Jump in there, listen, ask questions, and that's the best way to do your own research, I think. And then go back to your organization and ask, well, what is our stance? Do we have insurance? What's covered? Because I've learned there are a lot of CISOs who didn't know that they were even insured until there was an incident and somebody asked them if they wanted to call their broker. And so, and hopefully that's the exception, with CISOs, but definitely ask all of those questions I just pointed out.
I think that's great advice. And, I think not only the type of coverage, but maybe the amount of coverage. I mean, there's a lot to be considered there. And it seems like the CISO would have a lot of valuable input there.
Hmm. Absolutely.
So, I know I don't think I could do a conversation without bringing up the term AI. And so I think, I've been thinking about what is the overall impact of AI on risk and cyber risk.
Hmm.
When we think about what is the impact, then what is it that we need to be concerned about covering as organizations start to use AI? Provider organizations are really starting to look at how AI can help enable a lot of their processes and save costs and have better data for clinical decision making and all of that. Um,
Hmm.
but I also know that on the threat side, there are AI enabled attacks, right? So we know that's already happening. We also know that there is some perhaps risk with data sets where there's compromise or poisoning of data sets. There's
Hmm.
liability maybe around hallucinations and things like that could produce bad data or endanger patients. So this whole area of AI is so fascinating, and I just was wondering what Marsh McLennan's like overall thinking is on that.
Yeah, it's a lot of fun. I actually, just before this call, was one of my friends inside Marsh. She does a lot of our innovation and research. And one thing that was has been interesting with AI, big picture, we don't consider it a new peril per se,
Oh,
but it
okay.
increases the velocity and sophistication of existing perils.
Okay.
And that's as of today. Here
Right.
May 2025, AI all by itself isn't a new peril. It just increases the velocity and sophistication of existing. I think for healthcare organizations, there's what's the old and what's the new, right? The old, those of us have been around for a while. When we hear decision support,
Right.
capabilities in the EHR, that's kind of early gen AI,
Yeah.
right? And
Hmm.
and then we kind of transitioned into can AI read a radiology image at the same accuracy as a human but faster? Are there business cases where now with generative AI, the question is, well, what can I put my data into this and learn something from it? And I think in terms of the business aspect of it, I think the jury's still out on that. Can healthcare organizations use it to make money? They've been trying to monetize their data for years, right?
Right.
And it's been a challenge. But I think the key thing is, where is the data and what models are learning on my data? And do I own all of that? Is it inside my house? Is it going anywhere else? And are any of my, physicians, staff, faculty in a academic healthcare organization, are they using AI tools with my data outside of the sanctioned environment? But I say definitely create that approved environment and improved tools, and make sure your data stays there, and that any training on data is done in a way that you control it all, that you have a retention period defined, a destruction process defined. Everyone knows how to manage it and be very robust about it. But that's I think some of the new things with generative AI is what can we create with it? Like results, like in my charts, were those results that got burped out? Was that a generative AI response to your labs? I don't know, but I'm sure that the EHR vendors are thinking about that.
And in terms of risk, do you insure any portion of that risk at this point? Is there?
So what
Oh,
we I think
yeah.
what we'll do is that kind of that model of, it's an existing peril. How
Mhm.
are you using AI to manage it? Are you using AI to manage your data? Is it being done securely, and how much control do you have? And so, yes, it is something that is part of the insurance conversation about how are you using it, what data is involved, how is it being protected, a lot of data governance questions. I think AI,
Yeah.
that's probably data governance is having a new era, renaissance of we have to redo data governance now, and I think AI is driving a lot of that.
So for your conversations with your insurer, it's good to describe your data governance process and your AI principles, perhaps, and say, this is how we manage this now. And that helps in terms of managing risk. Okay, well, that's interesting. I mean, I think that'd be interesting to follow how your thinking goes along the AI spectrum in terms of risk. I think a lot of healthcare providers are thinking about that now, and saying we have all this on our plate, and we have some of our service providers using AI. How do we manage this risk? Again, I mean, I think with what you said earlier, talk to your insurance provider about these things, right? So I guess in closing, what's your best advice to a provider organization, and anyone who's interacting with you on determining the scope and nature of the policy as well as the limits of the coverage?
Include all of the stakeholders in the organization that are part of managing risk. And so it's not just the chief risk officer, it's not just the CFO's team, but the chief information security officer, the chief privacy officer, chief counsel, and maybe a handful of others, those who maintain disaster recovery, the CTO. There are a lot of people who can explain how well your organization's prepared. And so definitely include them.
And take advantage of the services that you offer, perhaps.
Absolutely. Find out what's paid for and use it.
Well, awesome. Thank you very much, Dan. This has been very interesting, and I think I'd love to continue the conversation. This is of interest to our CISOs at CHIME, and so we appreciate your time today. This is Lisa Gallagher, Health Stealth Radio.
Thank you.
Thank you for joining us today in the shadows for this episode of Health Stealth Radio with Frank Catita. If you like the program, please be sure to share your comments on our social media sites, or feel free to contact us with suggestions for new and stealthy show themes. We look forward to welcoming you again for our next broadcast. In the meantime, stay safe out there.